Yes, now we'll discuss about the cavernous sinus. This is dural venous sinus which has numerous small caverns, that means small spaces. Before starting the discussion about the cavernous sinus, we'll discuss about the how this dural venous sinus is formed. If you cut a coronal section like this, you will find this is parietal bone. Here is a suture. These are two parietal bones. This is sagittal suture. Here is sagittal suture. This is sagittal suture. These are parietal bones. Here is diploid. This is diploid. It is internally covered by this durameter. This is durameter. Durameter has two layers, endosteal layer and meningeal layer. So this is endosteal layer of the durameter, and here is another layer which is meningeal layer. This is meningeal layer. So here between two layers of the durameter, outer is endosteal, this is endosteal layer, and this is meningeal layer. Between these two layers, this dural venous sinus is formed, which is internally lined by endothelium. In this position, this dural venous sinus is known as superior sagittal sinus. And here, this inferior sagittal sinus is formed by folding of the meningeal layer. Here this sinus is formed between endosteal and meningeal layer, and this sinus is formed by folding of the meningeal layer. And this folding of the meningeal layer, here in this position, it forms falx cerebri. Here and here two cerebral hemispheres are present. So it lies between two cerebral hemispheres. So it is falx cerebri. This folding of this meningeal layer forms falx cerebri, tentorium cerebelli, and diaphragma celi. So at different places, according to position, this folding of the meningeal layer form the numerous falx, diaphragma celi, falx cerebelli, diaphragma celi. So these are the names at the different places of this folding. Here, according to position, this dural venous sinus is superior sagittal sinus, and this is inferior sagittal sinus. Now we'll discuss about the cavernous sinus. Before reaching to the cavernous sinus, we'll discuss about the cranial cavity. Here is this is anterior cranial fossa. Here is this is middle cranial fossa, and this is posterior cranial fossa. This is foramen magnum. So anterior, posterior, anterior, middle, and posterior cranial fossa. Here is position of superior orbital fissure. This is superior orbital fissure. Here is superior orbital fissure. This is lesser wing of sphenoid bone. This is superior orbital fissure. Here is pectus temporal bone, and here is foramen lacerum. This is foramen lacerum. This is pituitary fossa. This is pituitary fossa, and here is foramen rotundum, foramen ovale, and foramen spinosum. From here to here, this is position of the cavernous sinus. This is position of the cavernous sinus, like this. This is position of the cavernous sinus. So anteriorly, this cavernous sinus extends up to superior orbital fissure. This is superior orbital fissure, and posteriorly, here is petrous temporal bone. This is apex of the petrous temporal bone. This is posteriorly extension. So anteriorly it extends up to superior orbital fissure, posteriorly up to apex of petrous temporal bone. Its capacity is 1.5 ml and its anterior-posterior length is about 2 cm. Its transverse dimension is about 1 cm. It is divided into numerous small caverns or numerous small spaces by trabeculae. If you cut a transverse section like this, you will find this is body of the sphenoid. This is body of the sphenoid. These are sphenoidal air cells. Sphenoidal air cells. So this is body of the sphenoid, and here is junction of the body, and this is greater wing of the sphenoid. This is junction of the greater wing and the body of the sphenoid. And here this is pituitary fossa. Here pituitary gland is present here. This is pituitary fossa. Here pituitary gland is present. This is pituitary gland. This is stalk of the pituitary gland. Dural venous sinuses. Here you have seen this dural venous sinus is found between endosteal layer and meningeal layer. Here, this is endosteal layer, which is attached with the bone. This is endosteal layer. And another layer, that is meningeal layer, which is split from here, like this. This is meningeal layer. So this is meningeal layer, this is endosteal layer. Between these two layers, this space is cavernous sinus. This space is divided into small spaces by the trabeculae. These are the trabeculae, and these spaces are known as caverns. So this dural venous sinus is known as cavernous sinus. Cavernous sinus. If you see the relation of the cavernous sinus, here outside the sinus, numerous structures are present. Here, this is internal carotid artery. This is internal carotid artery. Here it gives anterior cerebral artery. This is medial cerebral artery. So this is internal carotid artery, and here you will find numerous anterior perforating substance. This is anterior perforating substance, and here is optic tract. This is optic tract. This is optic tract. And the structures which are related on each side, lateral side, there is temporal lobe. This is temporal lobe of the brain. This is temporal lobe. And on medial side, this is pituitary gland and the body of sphenoid with sphenoid air sinuses. Inferiorly, this portion, this is greater wing of sphenoid. So these are relations outside the cavernous sinus. Anteriorly, there is superior orbital fissure. Posteriorly, apex of the pectus temporal. So these structures lying outside the cavernous sinus. The structure present in the lateral wall of the cavernous sinus. So this is cavernous sinus, this is floor, this is lateral wall, this is roof, this is medial wall. So in this lateral wall, the structures present, these are, this is oculomotor nerve, this is third cranial nerve, oculomotor nerve. Here is fourth cranial nerve, that is trochlear nerve, and here is ophthalmic division of trigeminal. This is ophthalmic division of trigeminal, and this is maxillary division of the trigeminal. This is maxillary division of trigeminal. So these structures present in lateral wall of the cavernous sinus. Oculomotor nerve, that is third cranial nerve, fourth cranial nerve, trochlear, and ophthalmic division of fifth cranial nerve, maxillary division of fifth cranial nerve. These structures present in the lateral wall. And structure passes through the center of the, or through the substance of the, this. Here is internal carotid artery. This is internal carotid artery. This artery passes from here. It goes like this. This is internal carotid artery. And abducent nerve. This is sixth cranial nerve. Abducent nerve. So these structures present in the center of the cavernous sinus. These structures internally lined by endothelium. This is endothelium which covers like this. So this is endothelial lining. This is lateral wall. This is center. So these structures are related with the cavernous sinus. Now we'll discuss about the incoming channels. What are the incoming channels? What are the tributaries of the cavernous sinus? First of all, here is, if suppose this is cavernous sinus, this is schematic diagram. This is cavernous sinus, full of the caverns. Anteriorly, this is, here is superior orbital fissure. This is superior orbital fissure. This is cavernous sinus. Through the superior orbital fissure, there is a vein, that is superior ophthalmic vein. This is superior ophthalmic vein. The central vein of the retina, it opens either into superior ophthalmic vein or directly into the cavernous sinus. This central vein of retina and some tributaries of the inferior ophthalmic vein. So these are the incoming channels from the orbit, and the incoming channels from the brain. This is superficial middle cerebral vein. This is superficial middle cerebral vein. Here is inferior cerebral vein. This is inferior cerebral vein. And the structures from meninges, that is sphenoparietal vein. Here is sphenoparietal vein. So here is sphenoparietal vein. This is sphenoparietal vein. Sphenoparietal vein. And the structure may be frontal trunk of the middle meningeal vein. Frontal trunk of the middle meningeal vein. It also opens into this. So these are incoming channels. These structure, these venous channel comes from brain. These comes from meninges, and these from orbit. From here, now we'll discuss about the outgoing channels or communicating channels. From here, there is transverse sinus, there is sigmoid sinus. This is sigmoid sinus, and here is opening. This is jugular foramen, and after jugular foramen, this sinus become internal jugular vein. This is internal jugular vein. Here is position of the transverse sinus. This is transverse sinus. And here is sigmoid sinus. This is sigmoid sinus. And here is position of the jugular foramen through which it passes and continue as internal jugular vein. So this is transverse sinus. This is sigmoid sinus. So now communicating channel from here, the superior petrosal sinus. This is superior petrosal sinus which opens into transverse sinus. Here is superior petrosal sinus which opens into transverse sinus. This is superior petrosal sinus opens into transverse sinus. Here is inferior petrosal sinus which opens into internal jugular vein. Here is inferior petrosal sinus which opens into internal jugular vein. So another important thing, that is first tributary of the internal jugular vein is inferior petrosal sinus. This is important. Another thing, here is pterygoid venous plexus. So through emissary vein, it is connected with pterygoid venous plexus. This is pterygoid venous plexus. It connected with the pterygoid venous plexus. These emissary veins passes through. Here is foramen ovale. It passes through foramen ovale. Emissary is sphenoidal foramen. Here is foramen lacerum. This is foramen lacerum. So it passes through these foramina. So this is pterygoid venous plexus. And this pterygoid venous plexus, here is face. Here is position of pterygoid venous plexus. This is position of pterygoid venous plexus, and here is position of cavernous sinus, and these are numerous openings: foramen ovale, emissary sphenoidal foramen, and foramen lacerum. Through this cavernous sinus is connected with this pterygoid venous plexus, like this. Here is supraorbital, supratrochlear vein. Here is angular vein. Here is facial vein. This is facial vein, and this is deep facial vein. This is deep facial vein. This deep facial vein communicates with pterygoid venous plexus. So infection from this dangerous area of the face. This area is dangerous area of the face. From here, the infection from this area may passes through deep facial vein to pterygoid venous plexus. From pterygoid venous plexus, it may passes through these emissary veins into cavernous sinus. Here is cavernous sinus, and if infection reaches into the cavernous sinus, this is cavernous sinus, this is cavernous sinus, then it gives numerous symptoms and signs. Here, these structures related with the lateral wall of the cavernous sinus, these nerve compressed if thrombus is formed here due to infection. So this is oculomotor nerve, third cranial nerve. This is fourth cranial nerve. This is sixth cranial nerve. These cranial nerves are motor to the extraocular muscles. So if these nerves are compressed, then extraocular muscles become paralyzed. Another thing, these are two here, ophthalmic division and maxillary division of the trigeminal. If these two nerves are compressed, then patient feel pain over the area supplied by these. So this gives symptom. Another thing, if this, in case of the fracture of the skull, this AB communication is established. Atrio, this is artery, and this is jugular venous sinus. This is in case of fracture, there is pulsating pulsating exophthalmos develops. That in this case there is pulsating exophthalmos. With each heartbeat, the eyeball pulsate. So these are the clinical conditions related with the cavernous sinus. And also this cavernous sinus communicate from infection of one cavernous sinus may reach to another cavernous sinus through the anterior, there is anterior intercavernous sinus, posterior intercavernous sinus, and here is basilar venous plexus. Through this, infection of the one side may reach to another side. So this is all about the cavernous sinus and its clinical importance.